Why do Saline breast implants ripple? Imagine your breasts as a smooth, natural curve. Now picture tiny wrinkles or folds appearing on the surface. That's what we call rippling in Saline breast implants. It happens because of how these implants are made and how they interact with your body. Saline implants are filled with sterile salt water after they are inserted into the breast pocket. This filling process can sometimes cause the implant shell to develop folds or scallops if not filled properly. If the implant is underfilled or overfilled beyond the recommended amount, the shell can bunch up or create visible ripples. The outer shell of Saline implants is thinner and more flexible than silicone gel implants, making them more prone to wrinkling when not filled correctly. Saline implants tend to ripple more than silicone gel implants because the fluid inside is less viscous and more mobile. Silicone gel is thicker and more cohesive, helping it maintain a smooth shape over time. The fluid nature of Saline allows more movement, which can lead to visible or palpable ripples, especially if the implant isn't perfectly shaped or filled. Soft tissue coverage plays a big role in how noticeable rippling is. If a person has thin skin, minimal breast tissue, or low body fat, the ripples are easier to see or feel because there's less tissue to hide them. This is especially true on the outer sides of the breasts or near the cleavage, where tissue coverage is naturally thinner. Placement of the implant also influences rippling. Implants placed above the pectoral muscle, known as subglandular placement, are more likely to show ripples because there's less muscle tissue covering them. When implants are placed under the muscle, called submuscular placement, the muscle provides an extra layer of coverage that helps conceal any rippling. Choosing the right size and fit is important too. Larger implants have more surface area and can stretch the skin thin, making ripples more visible. If an implant is too small or not filled properly, it can fold or wrinkle more easily. Over time, changes like weight loss, aging, pregnancy, or breastfeeding can also make rippling more noticeable. As the soft tissue and skin become less elastic, ripples that were not visible before may become more apparent. Sometimes, scar tissue around the implant, known as capsular contracture, can also distort the shape and contribute to rippling. In summary, Saline breast implants ripple because their thin, flexible shells filled with fluid are more susceptible to folding and wrinkling. Factors like minimal tissue coverage, improper filling, implant placement, size, and changes over time all play a role. Plastic surgeons carefully consider these factors when planning breast augmentation. They might recommend silicone implants or placing the implant under the muscle to reduce rippling. If rippling occurs, it can often be improved through revision surgery or other soft tissue techniques. Always consult with a qualified plastic surgeon to discuss the best options for your individual needs.